In 2018, 1 in 4 older adults reported a fall. This equates to 36 million falls nationally, with 8 million of those requiring medical attention or limiting mobility for at least a day. My name is Ashley Campbell. I'm the Clinical Supervisor for Inpatient Physical Therapy at Salina Regional Health Center.
Well, Ashley, thank you so much for being on the show. We're going to be talking about falls. So let's start about talking about the damage that people can have from a fall.
Yes, falls are one of the leading causes of fatal and non-fatal injuries in older Americans. Falls threaten seniors' independence and safety, and they also generate enormous economic and personal costs. 1 in 5 falls causes a serious injury like a broken bone or a head injury. Specifically relating to hips, 95% of hip fractures are related to a fall.
And we're not talking about necessarily falls from a ladder. We're talking about just standing falls.
Correct. Right? Yep.
Yeah. Okay, let's switch our focus to fall risk. Okay, let's talk about that.
Many common household items are considered a fall risk. Things like cords, throw rugs. There's also improper lighting can also lead to a falls. Lack of or improper use of an assistive device, and also small pets.
I know we also have a fall risk appraisal on the website, right?
Yep. The fall risk assessment on Salina Regional's website, you can take that. There's a simple test, asks you a couple questions. You just click a box, and you can assess your risk for falls at that point in time. You can also print that out and take that to your healthcare provider on your next visit.
Actually, let's talk about what you're doing up in the physical therapy department as far as when somebody comes in, either because they are at a risk for fall or they have fallen. What do you do?
Yep. The Salina Regional website has a great little flyer that gives some information on what you can do to do some home modifications. Things like removing throw rugs, removing clutter, improving your lighting in areas like bedrooms, bathrooms, and hallways, making sure that you have shoes that are proper fit, installing grab bars and handrails that are appropriately placed. Other things you can do are things like making sure that you go over your medications with your doctor or pharmacist, having your ears and your eyes checked routinely, and then also make sure you stay active. Focusing on leg strength and as well as your balance.
Well, let's talk about some of the balance work that you do with the patients.
If you do fall and you're injured and admitted to the hospital, you will have occupational and physical therapy services involved in your care. We will go over things like getting in and out of bed, getting up and down from a chair, making sure that you can bathe yourself, making sure that you can get dressed, walking, your balance, general strengthening, as well as getting up and down or in and out of your house.
Well, Ashley, thank you so much for some great information and for coming on the show. And thank you for watching. For more information, you may visit the physical therapy page of srhc.com and like Salina Regional on Facebook and follow us on Twitter and Instagram.